Hey y'all, welcome to the Walk for Change short.
Hello, everybody. Bobby Rodrigo here with the Walk for Change, sitting here next to Charles Vargas from the Apache Nation, the San Carlos Reservation community. How you doing, Charles?
Very good. How you doing, Bobby? Wonderful day.
I'm good. You know, one of the subjects and one of the advocacies and one of the things we want to change in our society is to ensure indigenous right protections that are supposed to exist in our country and that have essentially never really done it, unfortunately. And I'm glad to have you on because I consider you an expert in this area because you live it. You know, I'm part Native American as well, and that's not something that I talk about a lot just because I just haven't come up that much, but I need to do it more. So I'm glad to have that discussion. So I want to, you have been doing this for a long time. You know, basically living it, walking it. I just wanted you to give us some examples of what what goes on in your advocacies and your battles on indigenous rights and protections. What's important to you?
Well, probably one of the most important things is that it is a broad range, or a rainbow, if you would, of affected, including what you just said yourself about being Native but not really feeling that it was important. There's generations that have hidden their identity, and those Native rights are just underserved, they're not appreciated. So along with this Walk for Change, we are promoting the rights of food sovereignty, medicine sovereignty, and that includes, people's ability to have free liberties. And so to those that are underserved in those rights, Native American, Hispanic, or even the Black communities, it's really about equality for everybody.
Yeah, and equality is a big part of the Walk for Change as well. I mean, all of these underlying and yet major issues that we have going on in our society, things are being dismissed, so easily, as you say. And for a lot of years, one of the things that you've been talking about is the way San Carlos has been treated environmentally. Give us some background on that.
Well, I would say all minority groups that really don't have the numbers to be spoken for are underserved in many ways, and we exemplify that. One is that we were a herbicide test site, which really isn't known. But not just that, it's the services that are provided are insufficient. And so we have health disparities, and we're dealing with this pandemic, and so we have added concerns. Sometimes, however misplaced they are, we're basically under pressure in a number of different ways of suffrage that are hard to see at first. And so these movements for change are great for bringing attention to these areas that just, again, are underserved or little spoken for. So we hope to see a greater interaction from our communities to participate, but also that we gain support for equalizing rights, on reservations like ours, and bringing attention to the herbicide issue that really is everyone's issue because it's an environmental issue.
I also noticed recently a number of reports, including in a committee that I sit on at the American Bar Association, about the challenges of voting for Native Americans. They were talking about the Southwest, particularly the Navajo Nation specifically, and how the inability to register for voting. Give us some background on that.
Just a real quick spot on it so that we can, for listeners, go and dig deeper on the subject. It not only affects voting, it affects everybody economically. For instance, if you register a corporation, they need a service agent address. And in Arizona, if you don't have a physical address, not a PO box, a physical address, well, you can't have a corporation, and that includes a 501c3. So just like that, voter registrations require an ID with a physical address. And on reservations, inherently, no reservation has a physical address. We don't have roads, we don't have address names, we don't have numbers. We're scattered housing on very large properties sometimes. The Navajo Nation is 27,000 square miles. Our reservation is 2 million square miles, and there's 16,000 people, and not one of them have an address. Just in short, that's a very exasperated issue of inequality. So thank you for asking that.
Yeah, and that's what they were talking about, and one of the platforms that I was sitting and listening to, the committee was trying to address. And that is a challenge because you're dealing with so many different hands with legislation on how to deal with that. And of course, the voter suppression is a real thing, of course. And then also, one last thing I certainly want to cover with you is the health of the nation, particularly yours and in the Southwest, but Indigenous and, as you mentioned, minorities everywhere, talking about relative to the pandemic particularly. I know that there's some staggering numbers down there, thankfully not in your specific reservation, but close to you. Talk a little bit about that.
Well, those disparities through economics also, as we all know, lead to health disparities. When you're disadvantaged, you have poor dietary. It's a food desert on all of these reservations. So growing food was discouraged. Look at the herbicide program. It was to defoliate the whole reservation, and that included our ability to grow our own food. So we became dependent. We have a joke nowadays. We say we hunt in Walmart, Safeway, and Bash's or Albertsons. We don't hunt in the forest anymore, and shame on us. We are the model for decentralized supply lines where communities were sustainable. Everyone had a garden, everyone had a cornfield, and it was a requirement. You had not just your own personal responsibilities, you had communal. And those are really, I think, some of the clear answers that are emerging in this crisis. But through the change that everyone's seeking, it's a collaboration. We share again. You know, we've been here for all the same principles before, now, and into the future, and that's to help and provide food, medicine, and shelter. That's our pledge. And so right now, I would say in a health condition, we're probably the most not only underserved, but severe condition-wise. Statistically, we have all the highest numbers for cancer clusters, for diabetes, for heart disease. Many times it's related to environmental conditions, but it's also living conditions and a lack of equality. So I think that all subjects are related at root, and the cause and effect is poor health. So another excellent question, Bobby. Thank you on that.
The tentacles of our society, which is why we walk for change and why we are glad that you and your community are part, because we're all one community as far as I'm concerned. Thank you so much, Charles, for joining us on this Walk for Change short. Remember, everybody, walk the number 4 change.us. See you on the road.
See you on the road. Thank you, Bobby.
And remember, it's www.walk4change.us.